So suppose I have given the homework, right? What was the first question?
Pain in mandible jaw, lower jaw. Pain is very acute.
Pain in the mandible, right?
Yes.
Pain in the mandible, okay? And pain is very acute, okay? So we have already discussed the head is yang, means bend heat hotness, and this face is yin, means humidity, dryness, and coldness, right? So this area is coldness, okay? So the step number one, we are choosing hotness meridian because we are doing the treatment in the head region. Now in the head region, we are going on the jaw, so we are selecting the coldness meridian. Is it clear to everyone? सबको बात clear है?
Yes.
So first we are coming to the hotness, entire head. Then we are coming to the cold, means mandible, right? So only two steps. Then we have to do the treatment. So look at here. See. So सरबजीत जी ने बोला था कि पहले मैं कलर फोटो दिखाऊंगा, है ना? तो मैं कलर फोटो ऐड कर देता हूं। ओके, चलिए। So in this image, now I asked you to do the treatment of the this area, coolness area, jaw area. So the step number one, hotness. Hotness means entire head region. Entire head region is a hotness as per our this classification. ये हमारा classification है, right? On the basis of this classification, number one we are choosing head means hotness. Then we want to go to the mandible. फिर हमें mandible पर जाना है. So this is the second classification that we are choosing the coolness. Only two steps. So step number one, that we are choosing the hotness. Hotness is equal to head region. Step number two, coolness. Coolness is equal to lower jaw. Then we have to do the treatment. There is acute pain or the sharp pain. So what is the treatment? Acute pain or the sharp pain? Sedate dryness. This is the main action. Then we can do the opposite action also, right? Okay, so this is the our treatment method which we have to plan. जो हमें करना है. So now let's do the treatment. So we can see this is the hotness meridian. The triple warmer, the hotness meridian. The first we are choosing the hotness meridian. Then in the hotness we have to go to the coldness meridian. So the second step, we are going to do the coldness meridian. So now in the triple bottom meridian, we will put the coldness point. So this is the coldness point. We can see the central point. So we will put the perpendicular needle here because we have to put the needle here. Neither we have to do tonification nor we have to do sedation. So we can put the perpendicular needle here, or we can put the methy seeds, or we can put the star magnet with the purpose to do renting. As soon as we are putting the coldness, as soon as we are putting the one point here, the coldness meridian will open. So now look at here in this diagram. So let's see here. The step number 1, we are choosing the triple bob meridian and putting this coolness point. इस पॉइंट पर हम एक छोटी सी निडल लगा देंगे या मैग्नेट लगा देंगे. Suppose we are putting the needle here. This is the perpendicular needle, right? Neither we do tonification nor we do sedation. Or we can put the seeds, या हम दाना भी लगा सकते हैं, ये हमने समझा था. So we can put the white color or we can put the methy seeds. We have to do the renting here. हमें यहाँ पर renting करना है. As soon as we are putting the needle on the coolness meridian, as soon as we are putting the needle on the coolness point, the coolness meridian will open. So where is the coolness meridian? We can know this is the coolness meridian here. ये हमारा coolness meridian मतलब urinary bladder meridian, इस पर treatment होगा. Now whatever treatment we are doing here, that will be the treatment of jaw. What is the treatment? Sedation of the dryness. हमें dryness को sedate करना है, तो dryness को sedate कर देते हैं. चलिए magnet से भी कर सकते हैं. So we will take the yellow magnet for sedation, white magnet for tonification. So let's do the dryness sedation and heat tonification because both are opposite forces. So let's do here. Dryness sedation and heat tonification. Done. This is the treatment. हमने dryness को sedate कर दिया. Yellow magnet visible from the up. Heat tonification. The dryness sedation is the main action. So the main action we will do in the controller. The main action also will be done in the super controller. This is the over. Treatment is over. Treatment completed. कितने लोगों ने यही किया जो मैंने बताया और कितने लोगों को confusion है? How many persons having little bit confusion for doing this treatment? Yeah, controller is the dryness sedation. Even the super controller is the dryness sedation. Got it? Everyone understood? Clear?
The controller is already busy now with renting.
Okay.
सर TW ऑलरेडी रेंट हो चुका है इसलिए हमको एक ही
कंट्रोलर
इंफॉर्मेशन
बिजी कैसे है जी?
सर TW से रेंट किया ना हमने. TW इज द कंट्रोलर.
हाँ रेंट किया ना उसको.
हाँ तो एक बार ही रेंट हो गया ना सर, तो मेरे को अब व्हाट यू से आई डोंट नो, लेकिन ऐसे लगता है कि दो बार ही हमको TW को इंफॉर्मेशन शुड बी गिवन ओनली ऑन सुपर कंट्रोलर इन दिस केस.
Look at here.
बाकी आप समझाइए सर.
So look at here now. So suppose we are taking but one star magnet. एक हम star magnet ले लेते हैं, ठीक है? So suppose we are making this as a star magnet. ये जो मैग्नेट है ना, इसको क्या आप स्टार मैग्नेट मान सकते हैं? इसको या इसका और कलर चेंज कर दें, चलिए और भी कलर चेंज करते हैं,
ब्लैक
ब्लैक कर दें, चलो जी ब्लैक कर दिया। अभी यू विल यू कंसीडर दिस मैग्नेट एज स्टार मैग्नेट, इज इट ओके और नॉट? अच्छा 2 मिनट रुकिए, मैं आपको स्टार मैग्नेट ही ले लेता हूँ, यू शुड नॉट कंफ्यूज।
सर एक ऑप्शन
Sir,
और बता सकते हैं सर, एक बात और हम अगर ट्राई करें, अगर हमको कोल्डनेस को रेंट करना है तो हम ब्लू कलर का डॉट भी डाल सकते हैं उसमें, अगर हम कलर से कर रहे हैं ट्रीटमेंट तो, बिकॉज वी आर गोइंग द कोल्डनेस मेरिडियन, so we will put blue color because coldness is of blue color. ये भी शायद हम कर सकते हैं,
ठीक
अगर
है,
आप बताइए।
मैं आपके पॉइंट्स पर आ रहा हूँ अभी, है ना, एक ही मिनट का समय दीजिए। ओके सो या
So many times, sorry to interrupt, in the same meridian, like if we are going on different detailed versions, like for the spine also, like we were going the front section, back section, then the lumbar, then the specific the uh, lumbar point, and then the main action. So many times the same meridian can be involved twice or something. Like once we rent on that meridian and again do the same action on the meridian.
कैन यू रिपीट अगेन?
एक ही मेरिडियन मतलब कैसा है, वंस आई एम डूइंग TW पे एक बार रेंट कर रही हूँ फॉर द फर्स्ट स्टेप और सेकंड स्टेप, एंड द फाइनल आई एम गोइंग स्टेप बाय स्टेप इन द डिटेल वर्जन्स, वो फाइनल स्टेप वापस TW पे आके फाइनल स्टेप हो सकता है, एक ही मेरिडियन 2-3 बार
हाँ
इन्वॉल्व हो सकता है।
यस मेनी
Like in
टाइम्स
the beginning we are renting on that, and then in the end some other action.
yeah, so like suppose there is a big mahal mansion, right?
Yeah.
So first we are entering through the door, okay?
Yeah.
Then in the second home, there is another room,
Hmm.
big room, but we are entering through the window, right?
Hmm.
Then third room, again we are
Hmm.
entering through the door.
Yeah.
Again fourth room, they are entering again through the window.
Yeah. Right.
So the thing is this: the previous triple warmer is the difference.
Yeah.
This triple warmer is the difference.
Yeah. That's what.
I will
Yeah.
give you another example. Suppose first we are taking suppose first we are taking hotness. Hotness means entire head region,
Yeah.
and right. Then we are taking coldness. Coldness means jaw, right?
Jaw.
If I take again hotness, now
Huh.
I have to divide the jaw in 6 energies, and then I will take the hotness. Means the next time I will take the hotness now.
That is a separate one.
Again, next step.
Yeah.
Again, next step, right? It will not be the same things. So as we
Right.
proceed, the things are coming same and same, but it is next.
Yeah.
Got it?
Understood.
In this way.
And sometimes only if we are doing like the final step, we are not going through the whole journey. Only the final step for the instant pain, unbearable pain. Is that also working?
As per my experience, it works, but it's not the
Yeah.
good idea because sometimes even I have done that thing, right? See, suppose
For just
we
immediate
have gone
results,
through with a
kind.
long journey. We have gone
Yeah.
through with a long journey, and finally we have reached on the triple warm meridian, right? Because we have to do
Yeah.
the final treatment of the triple warm meridian. So sometimes what we
Huh.
think, okay, let's do the treatment of the triple warm meridian because we already know now,
No
right?
idea.
But okay, we can do this and it's working. But renting method is very important because by the renting method, we are also stimulating, also covering many other things. Many other.
Yeah. Yeah. That is there, of course, to remove the problem from the depth, from the roots.
Yeah. But that
Okay.
is working, and there are many things like we have seen. Suppose then if you learn triorism, so they have made all the journey, and finally they have given you this is for thyroid, this is for thymus. They are giving you a direct fruit, right?
Right.
But as per BC, if we are going with the steps now, it's giving
Right.
better results.
Okay. Yeah.
Because
And but sometimes now suppose people are having lumbar pain. In that also they have lumbar 4, lumbar 5, even sacral 1. So then how do we take all the three?
Yeah.
All the three are the main action points.
So the thing is this, that's why we have to learn individual classification, then bigger classification. Suppose there is a paneer, this much paneer, right?
Yeah.
Here one box of the paneer. We can make we can make 20 parts, right?
Right.
Like suppose there is one paneer, right? We
Right.
can make small 26 part, okay?
Hmm.
But we should also know how to make only 10 parts. We should also know how to make the 6 parts, because the multiple
We need to take all the things together also.
Yeah. So then we are doing little bigger classification.
Okay.
Fine. Bigger classification, then we are taking 2-3 vertebrae together.
Right.
In that way,
Yeah.
we will automatically get that sense.
Hmm.
Automatically, because we are going to do lots of classification. Huh? So automatically,
Right.
this we will understand, oh, let's do in this way.
Yeah.
Okay?
Yeah, it is definitely working. The
Yeah.
pain and all
Will
is
work.
reducing.
Yeah.
Yeah. So,
But it will work. Suppose
yeah,
we are
thank you.
going to do the treatment of the knee, right? We are reaching on the knee. But knee is not the small structure. Knee is very bigger structure. Right?
Yeah.
You want to go one step more, then you can go in the fluid of the knee, in the ligament of the knee, in the tendons of the knee, the bones of the knee, the fascia of the knee, the cartilage of the knee. Am I right or not?
Yeah.
So this depends on us that whether we want to treat only meniscus, only cartilage, only ligaments. Then we have to do more journey, right?
Right.
You just want to stop on the knee, right? Just reaching on the knee and over.
Okay.
Suppose I want to do the treatment of eye. Yesterday we discussed the treatment of ear.
Yes.
Ear. So I told you first go to the hotness, means head region. Then for ear, which energy we have to select?
Heat.
Heat.
Heat means as per the classification, we know that
SI.
the heat is coming right here. You can see the classification. I will show you once again. Look at this classification as we discussed yesterday. Suppose you want to do the treatment of the ear. So this is the classification, right? This is the heat. Okay.
Yeah.
Now what we are doing treatment of the ear. But we can again go one more step in the ear, because ear is the very big structure. In the ear, we have external ear, middle ear, internal ear. Then inside the ear, we have bones. In the ear, we have fluid. And the external ear having different work, middle ear having different work, internal ear having different work. We can do more journey till we have knowledge. Suppose we don't have knowledge of what to, then stop on the heat. Do the treatment of the heat. But suppose no, you are telling, no, I want to do the treatment only the bones, because 3 bones in this ear, 3 bones in this ear. I just want to do the treatment of the bones of the ear. Then you have to go more, you have to follow more. But you should have that knowledge, right?
Yeah.
The structure of the ears, then the further classification of the ear. Okay. So the 6 key is all about, we can go at the more and more deeper till we have knowledge, till we know the next step, right?
Right.
Then you are reaching on the bone of the ear. Now still you can divide the bone in 6 parts. You can go more step. So there is no end. Stop at any point where we as per our limit, right? Our limit of now hotness, this is the hotness. Okay. Now the next step here is the heat. Done. I don't know what is next. Then stop here. Don't bother too much. Okay. Then stop. That is enough. And it will give the results. Got it?
Okay.
Today I have opened too many presentations, so it's confusing me. Give me 1 minute. Okay. Okay. So let's see here. Got it? So just reaching on the heat, that's enough. I want to treat the jaw, coldness enough. In this way, we can do the treatment. Is it clear or not, everyone?
Yes.
Okay, fine.
Sir, in coldness, only lower jaw will come, na?
Yes, yes.
Yeah. That.
Coldness मतलब lower jaw, only lower jaw, not the upper jaw. Just see this image, then you will understand. आप इस इमेज को देखिए, आप बताइए क्या इसमें अपर जॉ है क्या? Do you think upper jaw is here? Not, right? Upper jaw is here, right?
Yeah, yeah, right.
It's the lower jaw. Upper jaw is here. In the upper jaw, we have upper tooth. In the lower jaw, we have lower tooth. As per this classification, we have to go in the lower jaw. Got it?
Yes.
Okay. So done. We have discussed one question, that is over, completely over.
Yeah.
Yes.
Yes.
Then we go ahead to the next question.
सर स्काल्प कहाँ आएगा सर?
Scalp. Are you
हाँ
asking
सर,
scalp?
स्काल्प मतलब यही क्लासिफिकेशन में आएगा? यस.
हाँ, इस क्लासिफिकेशन में हमने आपको बताया, देखिए इधर
हाँ.
देखिए, लुक एट हियर,
हाँ
आप ये देखिए, आपको समझ आ जाएगा. So when we are doing the classification, what we are doing,
wind. Okay.
this is the brain. We are keeping it under yang. This is the
हॉटनेस,
face.
हीट और विंड,
We are keeping it under the yin, right?
ये तीनों स्काल्प कवर करेंगे.
So yang means wind. Sorry, wind, heat, hotness.
ओके.
Hotness are making your
हाँ.
scalp.
ओके. विंड, हीट, हॉट.
Wind means like this occipital region, occipital, back part of the head. The heat means next to that, right? Then we can
Yes.
consider the front part of the scalp, that is the hotness.
Okay.
So yesterday we have given you one question that when someone is suffering with a very, very severe unbearable pain here, what will be the treatment? So the step number 1, hotness. Hotness means head region. Then I marked here and I told you again hotness. Hotness means the top of head region here. Okay, hotness, then hotness, right? Then we have reached here. तो हम यहाँ पर पहुँच गए. Now I told you the person is suffering with a severe pain which is unbearable.
Okay.
Severe pain which
Severe
is
pain.
unbearable, right?
हाँ. Humid.
So now there are two conditions here. We will discuss both the condition. Because as per our previous discussion, severe pain and the unbearable pain is the coldness energy, right?
Yes.
So as per this concept, we should sedate it, right?
हाँ.
We should sedate the coldness and we should increase the hotness as per this concept. So first let's do this, then we will also think in a opposite way. पहले हम इसको करते हैं. So that one person is suffering with a pain here.
Sir, can I ask you a funny question, if you don't mind?
In this part. Okay. तो क्या करना चाहिए? Let's see. The pain here. So the step number 1, we are choosing the hotness as per this classification.
Yes.
So we are choosing the hotness, right? Hotness means head region. The step number 2, again we are choosing the hotness as per this classification, right? So again hotness. So this is the near top of head region. Okay, now I am telling you studied coldness because unbearable pain. So first think about this, then we'll also think opposite. Okay, if we want to study the coldness, so let's see here. So the step number 1, what we are doing, we are going to the hotness meridian. So this is the hot. First, I will remove this magnet. Otherwise, it will confuse you. Yeah, I will remove all the magnets. Okay. Step number 1, this is the hotness meridian. Now, step number 2, we are choosing the hotness point. So for that, what we are doing, we will be choosing we have to choose the star magnet. चलिए एक स्टार मैग्नेट ये स्टार मैग्नेट है, राइट? Star magnet. So what we are doing on the hotness meridian, we are putting the hotness point star magnet because we want to rent it. हम इसको rent करना चाहते हैं. कलर थोड़ा बदलेंगे चलेगा स्टार मैग्नेट का.
That is coldness point, na sir?
You are putting on coldness.
अभी ठीक है. अभी तो आप सब लोग एकदम इंटेलिजेंट हो गए भाई. अभी सही है जी.
Yeah.
चलो जी, इसका रंग बदल दूं कि चलेगा ये वाला?
ये पिंक ले लो सर. अच्छा
हाँ
हाँ ये पिंक ले लो.
चलेगा ये.
हाँ
चलो ठीक है.
डिफरेंट है ना.
ये हो गया हॉटनेस में हॉटनेस को रेंट कर दिया. नाउ we will reach again on the hotness meridian only. Okay, now unbearable pain, so I'm telling sedate coldness and tone hotness. अब यहाँ पर तो जगह ही नहीं है, टोन कैसे करें? बात समझ में आ रही है आपको? Because we don't have place here. How to put the magnet, one magnet then the other magnet?
So remove previous one and then put the other one.
हाँ, तो एक तो ये ऑप्शन है. और बताइए any other options?
सर
दूसरा-
रेंटिंग के पे ग्रीन कलर लगाएंगे. रेंटिंग के वक्त ही हम लोग कर सकते हैं.
हाँ फिर से बोलिए ज्योति जी.
सर रेंटिंग के वक्त रेंटिंग की जगह हम हॉटनेस को टोन
Tone.
कर सकते हैं सर
So
डायरेक्टली.
first thing, remove the previous magnet and put new, right? Second thing, as per Jyoti ji, we already know that in the future we are going to turn this point. So during renting time only we are doing the same thing like tonification, but that time renting is happening.
Sir,
Third thing, even
sir, actually in renting, what we can do is like we can just touch the point also, which will open the door automatically. In
Yeah.
renting area, just touching also will open the door. So instead of
yeah,
putting any
definitely
at the
that is
time, that
also.
itself
This
is
is
enough.
all three options are right. All three options are right, right? You touch and go move ahead because in the future you are going to set at this point. But all three are right, right? Because many times even when I was doing the 6 Ki treatment, and I was thinking, oh, I have to set at this point. Then I was setting in the start or tonification in the starting only, and after that touching and going ahead. So these three options. Any other options?
सर अगर हम नीडल से ट्रीटमेंट करेंगे तो we'll
Yes.
put
Then we
perpendicular
can put.
on TW.
Then we can put
Ah.
2 needles.
Then
there.
it will sedate it. Then we'll just tilt the needle in the
Yes.
sedation.
No. Yeah.
angle.
So what we'll do? Suppose we are doing the treatment with the needle.
Yeah.
Let's see the treatment with the needle. What to do? चलिए एक बार needle का treatment देख लेते हैं. Suppose we are not doing treatment with the magnets. We are doing the treatment with the needle. So first, what we are doing? We are choosing the hotness meridian. In the hotness meridian, we are renting the hotness point. Okay, this is the step number 1. So now we are coming in the same meridian. हम उसी meridian में आ गए. Now what to do? We have to sedate the coldness. So now we should know the direction of the energy. अब हमें ऊर्जा का दिशा पता होना चाहिए. बताइए index figure में what is the direction of energies? Energy is moving like this. Am I right or not?
Yes. ऊपर से नीचे. Right.
This is the direction of the energy in the index finger. So now I want to sedate the coldness. So I will put the needle here. I will give the opposite direction.
Towards Nile side.
Got
Towards
it?
Nile.
Now I will tonify the hotness. I will put one more needle and I will put here. So in the hotness point, there are two needles now. The first needle there was renting, this one, and the second needle now we have put, which is doing tonification. We can put two needles, right? No problem. Got it? Clear?
Sir, one more thing I want to ask.
Yeah.
Sir, if you will give the treatment, if the patient is saying, I have a pain in the parietal area, then we'll be treating it in the hotness. If we'll say
Yes.
that I have a pain in the temporal or occipital area, then we'll choose the energy like that only, heat, dryness or whatever is coming in that area.
Yeah. So we have to choose the classification which suits.
Whatever patient is saying.
Yeah, as per the patient complaint, then we have to choose the classification. There are multiple classification, right?
Yeah. हम ऐसे कर सकते हैं ना?
So we have to choose the classification as per the patient condition. Got it? Still, there are many head classification are left, but I want to tell you the treatment of arm also. So I am giving you now two more classification. So let's see.
So this clear
Sir,
this
a
also, na,
question tha.
hotness will not increase the
So
hotness.
now the question is this: कि क्या हम, is it good idea to study the someone is having severe unbearable pain here, right? Whether it's the good idea to tonify hotness. Why? Because this is the point DU20, and DU20 is also the meeting point of the liver meridian and all the yang meridian. Sometimes someone is having excessive heat in the body, and this point might be painful. So whether it is a good idea to tonify hotness. Is it good idea? So what we have to do? See, I'm asking you one question. Do we do moxa on DU20 or not?
Yes.
Yes.
On hotness, no, but coldness,
Yes, sir.
No. Listen.
No.
We do
say
it, sir,
DU20,
provided if there
and
is no
sometimes
high
we
BP.
turn also. We do both action as per need, right? See, suppose some female is having spleen chi deficiency. DU20 tonification is very good. It is lifting the energy up. Someone is suffering with a spleen sinking, like varicose veins, or uterine prolapse, or erectile prolapse. Okay, lots of teeth marks on the tongue, spleen chi deficiency. We tonify the D20. Prolapse, we want to lift energy up. We do the moxa on the D20. Okay, but we can't do moxa if the person is having high BP. If the person, so what we have to do? We have to cross verify. Okay, the person is having severe pain here. Now cross verify whether person having lots of anger, lots of heat. You can see the tongue. If the tip of tongue is red, tip of the tongue is doing the representation of the brain. If the tip of the tongue is red, it means the heat is already high in the head. Then please don't tonify heat and hotness. Then don't do moxivation. Don't do moxivation if the person is having high blood pressure on the D20. But it's a very good if the person is having chilling feeling, shivering feeling, suffering with the coldness conditions or the low BP. It's very good if you do
Fever.
20. It will be lifting the energy up, and it's like a DU20 is like a fountain who will lift all the energies up. Like fountain can lift the, if you keep the ball on the tip of the fountain, it will be keep on lifting. Got it? तो जैसे फाउंटेन के ऊपर आप एक छोटी बॉल रख दो, वो ऊपर बनी रहेगी. ठीक उसी प्रकार से DU20 हमारे संपूर्ण शरीर की ऊर्जा को ऊपर लिफ्ट करेगा. That's why DU20 bleeding is also good treatment. That is sedation. DU20 moxivation is also very good treatment. That is very super tonification. Clear? So we have to cross verify because this is the point of meeting point of all the yang meridian. We have 6 yang meridian, right? Large intestinal meridian, small intestinal meridian, triple bomb meridian, gallbladder, stomach, and urinary bladder meridian. All the yang meridian meeting on the D20 or in this area, plus liver meridian. Liver is the single yin meridian who is also coming on the vertex on the top of the head. So that's why many persons having liver disharmony, or they have removed the uterus because uterus is coming under the energies of liver, they suffer with a vertex headache. Or many females are having some menstrual problems and they are having vertex headache. Okay. So vertex headache means the involvement of the liver. It might be some problem of the liver pattern, liver blood deficiency also, liver heat also, whatever, right? Vertex of the head is having connection with the liver. So do the cross verification before doing any treatment.
सर
Clear?
यदि दोनों कंडीशन हो, यदि पेशेंट का टंग भी रेड हो, क्रैची हो और उसको शिविर भी हो रहा हो, तो व्हाट कैन वी डू?
अगर उसका टिप ऑफ द टंग रेड है, राइट?
या
अब देखिए
और लार्ज इंटेस्टाइन का एरिया भी रेड है.
कहाँ का एरिया?
लार्ज इंटेस्टाइन का जो एरिया है, जो आपने अभी टंग डायग्नोसिस में जो बाद में चार्ट बताया था, उसमें लार्ज इंटेस्टाइन का एरिया और जो लंग्स के साइड का, स्टमक के साइड का जो एरिया है, this one.
Okay, so it's very simple to think what to do. Suppose one person is having shivering, right? So whether you उसे आप ओढ़ने के लिए रजाई देंगे कि उसको बोलेंगे कि भैया थोड़ा ठंडे पानी के नीचे जाके बैठ जाओ?
रजाई देंगे ना.
That time we have to do the treatment. If the person is suffering with lots of shivering, means body is trying to create the heat in the body. What is the shivering? Shivering is the mechanism of the body, the friction of the cells trying to create the heat in the body. We are shivering, that's why. Or we want to cover ourselves. So during that span of the time, you have to do the moxibustion. But it's not necessary to do the moxibustion DU20 only. We are having many other points. Like we are having this lungs area. But because the few points are having super yang lifting effect, governing vessel 4 and governing vessel 20, 2 points are increasing yang very high, fast. So if you're feeling that cross condition, like you told, the person is also having red tongue, also having shivering, right? So in that condition, first we have to think about the shivering. But suppose someone is having high fever and shivering, then we can't do. The fever moxibustion is contraindicated. It might happen. That is we have discussed when some bacteria virus attacking in the human body, it's crossing 6 levels. You remember? I've discussed many times. Yes. We have 6 defense layers of the defense. Number one, when your bacteria virus attacking on the first level, person will start feeling shivering. When any bacteria virus crossing second level, person will start feeling heat and fever. And when a bacteria virus and reaching on the third level, then alternate shivering and the heat, right? In this way, we have to take the decision. If the fever, then we can't do moxibustion. Clear?
Okay. So then what we will do in hotness point, we will even method will do.
In which condition? If,
in this headache on the vertex, unbearable pain, we don't want to increase the hotness, no?
No. We can do, I told you, if we can do moxa, then we can also tonify.
Okay, for headache?
Yeah.
That is BP is high then?
I'm telling you, see, we have to cross verify. If the person is having high blood pressure, please don't tonify. If the person is having more heat, then don't tonify. But if the person is having coldness condition, you can do tonification. Person is having low BP, you can definitely do tonification. And tonification only will bring the BP in the normal condition. Suppose person is having low BP and we are doing tonification of D20, it is good. It will increase the BP.
Sir, can we sedate wind in this?
Yeah.
Can we sedate wind also in this, as he's having a severe movement is more, no? In this protocol only, can we sedate wind also? As you are saying,
actually, actually, there are many things we can do, but still I not started. I'm just going with the access rule. And I also told you that the grandfather, we will learn that thing also.
Yeah, you said this earlier also, sir.
Because I will, right now I'm discussing only access rule. Just I want to make sure that everyone is understanding. Then slowly I will introduce all the rules. Grandmother rules, grandson rules, subjugation rules, anti-subjugation. All the rules I will explain. Yes, Riyazji. I can't hear you, please.
Yeah, I have a question. So, for regarding the first example, we were discussing about the mandible pain, acute mandible joint pain. Okay, that means we selected hotness rendered to the heat area. Okay, that means it's a similar thing which can happen in the spinal and that bottom of the spine area also, coccyx area. Am I right? So
Coccyx area, you're asking about the coccygeal area?
Yeah, it is a similar rending, am I right?
Yeah. The same concept
Yeah,
we have to follow.
that means if we treat something about the mandible area, is there some kind of additional bonus is in the other area also?
Yeah.
The
so
benefit.
the thing is, yes, I understood your point.
Then one more thing I wanted to add according to this thing. So it is matching. That means we can also benefit some other area of the body also.
Yes.
And it also can be contraindicative some other issue also.
Yeah. So the question is this, Riaz ji is asking, suppose I'm selecting hotness.
True.
Means I'm selecting this.
Yeah.
Then again I'm selecting coldness. Then I'm selecting this, right? These are thought number one.
Yeah,
but he's also thinking, suppose I'm searching hotness. Hotness means spine.
Fine.
Then coldness. Coldness means coccyx bone, right? Coccyx bone. So the treatment will go on the mandible or the coccyx bone, right? So that's why we are telling body is very deeply interconnected. So when it has been told, like even the person is having one pimple here, right? The person is having some pain in the back. The person is having some problem in the if you go in the colon.
Yeah,
many things are connected. Many things are connected with each other, and everything is happening, and they are connected with each other. We are trying to do the treatment of one problem, and many other problems are resolving at a time. Right? That's why we are trying to find out what is the exact problem, because many things, like if you know, like if our digestion is good, right? If our colon is very good, our skin will be very beautiful. If skin is having lots of pimples and dull, dark skin, 100% the male and female having no any control on the food or the hormone imbalance. If the person is looking very beautiful, charming, it means either they are taking care their diet very properly, or their digestion is very good, or condition of the colons are very good, or they are doing detoxification in such a way, or they are living in the atmosphere, automatically their colon is healthy. So that's why we are telling what we inside that reflected outside. Okay, so everything is connected. The person might be suffering with the problem on the mandible, but there might be some other 10 problems. Maybe they are not that much visible, maybe very slightly visible, right? But it will be there. If you try to praise the coccyx bone, then person will know I am having pain here, but otherwise he's not complaining you.
True.
That's why.
Thank you.
We know in the acupressure what we do. Person is having a headache. We are pressing here. Oh, I am having pain. You press in the feet. Oh, I am having pain. You press anywhere, which is the point connected with that problem, that is painful or not. So all the points of, suppose I am suffering with the eye problem, all the points, whether in the ear, whether in the sujok, whether in the feet, in the reflexology, in the spine, all the problem which is connected with the eyes, they will be painful. Right? So suppose I am correcting any one point, they will correct all the chain. Okay?
So this energy classification is really complex.
Complex. That is true. But the beauty is this: we have to learn complex things. Then, because easy things there.
Okay. But
easy thing can be learned very nicely. But
all remember all this classification.
You know, when there is a kid in the class 1, maybe it's very difficult for him to read the book very fluently, right? But if you ask the class 5 or 6 kids, they can read very nicely now. So right now it's a complex for us, but it will not be after a few months.
Yeah, we have to practice straight away.
See, and it's a beauty that you are learning something which is very complex. Why? If it is, then what is the meaning of learning?
Yeah, after all, this is a more
complicated thing.
Complex.
So cutting the body, like when someone is becoming surgeon now, cutting the body and connecting arteries, igniting artery, cutting, everything is complex. But when they learn, they are called surgeon, right? And we are an acupuncture surgeon. So let's learn complex. No problem. You are learning, I am learning, we all are
Thank
learning
you.
together.
You are with us. We don't have any worry about that. Thank you.
Yeah. In the beginning, it was difficult, but now it's quite simple thanks
Keep
to
on
you.
Yeah,
messaging
but
me.
we can prepare for more complex questions.
Yeah, you are explaining in a very nice way, so it's becoming simpler now.
Yeah, I am like still I'm thinking 2 times before putting anything in front of you, because I know if I put little more, then it will become very much complex.
I
No,
never
but we are
normally I
blessed
never
to
ask
learn
questions,
from
but
you.
this particular subject I have to ask lot of questions.
Yeah.
Because it's
So
really
slowly, you will know after 2 months.
yeah.
If I tell same thing now, what I am telling today, you will tell us, sir, go ahead. What you're telling me, basic things.
सर ऐसा होता ही नहीं कभी भी।
Like many
सर
persons in
आप
this group
उस
are.
चीज को इतनी
Yeah.
तरीके से बताते हो कि ये ना वो फीड हो जाता है
अभी
दिमाग
तारीफ
में।
वारीफ मत करो, है ना, तारीफ का मूड नहीं है अभी है ना।
तारीफ
आगे
तारीफ
बढ़िए।
ही है।
नहीं but आप हो लायक तो करना पड़ता
अभी
है।
क्या है ना, देखो
You are right, sir.
तारीफों से जब खुश होना चालू करते हैं ना, कहते हैं कि ना तारीफों से खुश हो, ना किसी के टॉर्चर से दुखी हो, तो ये अच्छा है।
नहीं सर, वैसा नहीं, आप एक्चुअली है वैसे।
Yes, yes.
हमको तारीफ करना जरूरी है. You don't take it too much. As students, we need to feel blessed to have you.
Yeah. So we have to dance every. We all
Yeah.
together.
Yeah, Christmas.
सर आपने तो बहुत अच्छा डांस करा था।
किया ना, मजा आ गया हमको भी।
मैं आपको देख रहा था खाली।
क्या?
तुमको देख रहा था मैं सर में डांस में। उसमें सिर्फ तो मिलता सर।
चलिए एक क्लासिफिकेशन सीख लेते
सर
हैं।
सेकंड एग्जांपल भी सॉल्व कर दीजिए ना। डल पेन इन फॉरहेड, वो रह जाएगा।
डल पेन
इन फॉरहेड किसी को चाहिए तो
फोरहेड।
हाँ।
ओके। So regarding the dull pain in forehead. Okay. So again, first we are choosing the hotness. The step number 1, we are choosing the hotness. Then we have to go to the forehead. So as per this classification, if we see the forehead, can you tell me what is the forehead here? Humidity. So the step number 1, hotness. Hotness means head region. And the step number 2, forehead. Forehead is humidity area. Now we have to do the dull. What is dull pain? Dull pain means humidity, so shaded humidity. And tone opposite, that's it. Is it clear or not?
Yes.
So now when we are planning the treatment, so look at here. So step number 1, we are going to the hotness meridian. This is the hotness meridian. Then I told you forehead is the humidity. So this is the humidity. We are putting the perpendicular on the humidity here. That is the perpendicular on the humidity. That is the forehead area. Humidity meridian will open. Now do the treatment. That's it. The humidity meridian will open. Now humidity sedation. So we have to set it this point. Put the yellow magnet and bend tonification. Tonify this point. The main action is humidity. So which will go in the controller and super controller. So here repetition of this humidity on the controller. So again, we can do the same thing but we have done earlier. तो ये भी सिंपली वही कंसेप्ट है. Is it clear or not? Okay. Still, I'm telling you, if anyone is not clear, you can message me personally because someone might think, oh, maybe कोई हंसेगा मेरे ऊपर, मैं पूछूंगा मुझे नहीं आता. Don't think in that way. Just message me personally. There are many talented person in this group. I will appoint one person for you who will make you understand very basic thing, right? Okay. So now I want to tell you one classification. That classification is useful only for doing the treatment of arm and legs. Okay, arm and leg. What is that classification? Let's see here. Now you have to look this image. Again, I will repeat. This classification only useful when you're doing the treatment of the arm and leg. So in this classification, we are using two images. अब हम जो बात कर रहे हैं इस क्लासिफिकेशन में हम दो इमेजेस का प्रयोग करते हैं. So we can tell image 1 plus image 2 be used in this classification for doing the treatment. All the two images should be will tell 1 and 2. So look at here, both the images. Whenever you are planning the treatment of arm and legs, always use these two classification, 1 and 2. What is that? 1 we already do. Wind heat hotness, humidity dryness, coldness. The second classification here. Now in the shoulder joint we have three joints. Shoulder is the wind, elbow is the heat, and wrist is the hotness. Then opposite side is the humidity. I will explain this, so don't worry. Humidity, then the dryness and coldness. It's very easy. I will explain you. I'm just talking about the arm. So look at here now. Suppose, tell me, these are my two arms. Which is yang, which is yin? Yang कौन सा, yin कौन सा? बताइए.
Left is yang, right is yin.
Left is yang. Left is yang.
Left is yang. Is it clear? Chalo, fine. Left is yang. Now, so left is yang. Got it? So I'm starting from your wind, heat, and hotness. My wind, heat, hotness, because I am going toward the yang side. Then I'm coming back, humidity, dryness, and coldness. So this axilla area will become coldness. So I am making this full circle here. Wind, so this is the yang. So I'm growing wind, heat, and hotness. Then I'm coming back from here, humidity, dryness, and coldness. So we have to remember this classification. So I will write here now. So as per this classification, the left arm is yang, the right arm is yin. Okay, this is the point number one. The left arm is yang. So we are starting from your bind. What is the meaning of bind? The meaning of bind is arm from shoulder to elbow. Arm from elbow. Shoulder to elbow. Got it? This is the bind. Then heat means elbow to wrist. Then hotness means wrist to finger. Got it? We have to remember these three things. We are talking about the, so this is the left, 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 and left. And in the right side, again, we have to do the reverse. In the right side, so if I'm telling again, then the humidity. What is humidity? Humidity means
Right
तो
wrist.
फिंगर्स रहेगा ना, फिंगर्स टू रिस्ट होएगा ना हॉटनेस ह्यूमिडिटी, है ना?
Fingers to wrist. Yeah.
finger to wrist. Okay. Right? Humidity means finger to wrist. Then dryness will be
Wrist.
wrist to elbow.
Elbow.
And coldness will be, what is that? Elbow to
Shoulder.
axilla. Elbow to shoulder.
On the right hand, am I right?
Yeah, this is on the right side. Okay, right. 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 So whenever you are doing the treatment of any arm, always combine two classification, classification 1 and classification 2. Suppose I want to do the treatment of left elbow. I want to do the treatment of the left elbow. So first I have to choose the left arm. What is the left arm as per this classification?
Heat.
Heat. I want to do the treatment of the right arm. What is the right arm as per this classification?
Dryness.
Dryness.
Left leg. What is the left leg?
Wind.
What is the right leg?
Coldness.
Coldness.
So whenever I want to do the treatment of the arm and leg, first I have to choose one energy from this classification. Okay, now suppose I want to do the treatment of the left elbow. Not left elbow, the entire this area. Elbow to, the person is suffering with the pain, elbow to wrist in this area, elbow to wrist. So first my selection, I am choosing the left arm. Let's choose the left arm. So left arm is equal to heat. Okay, done. Now my target is left to elbow to wrist area. So my target is left to elbow to wrist area. Got it? So that will be the, again heat. Okay, now I will do the treatment. If the person is suffering with the pain here, suppose one person is telling you, oh, can you treat my pain here in the left side? So bind, heat, hotness, humidity, dryness, and coldness. Is it clear or not?
Can you clear it in renting way? This protocol only, left arm pain.
So first I have told you what we have to do. First we have to choose the heat. Got it? Second, again we will choose the heat. So let's do the heat. Suppose one person is telling you, oh, can you treat my problem? I'm having some red itching, red pimples here, some redness here. Okay. Some races here, red color races here. Where? In this area. Okay. Red color races here. So red color races, it is not psoriasis. It might be some person is telling you, oh, this is the allergic. I'm having a red color races here. Got it? So remember one thing, when the person is having a red color races, if it's allergic. What is allergy? Allergy means whenever liver attacking anywhere. Liver attacking on the lungs, lung allergy. Liver attacking on the skin, skin allergy. Liver attacking on anywhere, it creates allergies, right? Allergy means the involvement of the liver. That's why if the allergies, we always tell bind plus plus, and we can also tell heat plus plus because it's the red color races. Bind is high, and bind is high, then heat is also high because it's the red color. But the prime target, the allergy is the bind, right? Without the attack of liver, allergy cannot be created. That's why you remember in the auricular acupuncture, we are telling this the allergy area, the ear apex. That also called liver area, liver yang. So liver means allergy. If you calm down the liver, allergy will be coming down. Allergy will be reduced. If you calm down the liver. If you sedate the liver, allergy will be coming down. Okay, so I will repeat again. The allergy is the sign of hyperactivity of the liver, or we can tell liver heat. Calm down the liver. So what we are doing for these types of the allergies, calm down the liver, calm down the bind. Bind is our primary target. If the red color races, we can also calm down the heat. Okay.
Sir,
Fine.
any allergy or skin allergy?
If it's like suppose you are asking about the psoriasis is an allergic condition, but that will become dryness.
No, if it's wheat allergy, if it's
Which
wheat
allergy?
allergy.
Wheat allergies. Yeah, so we will coming to the any allergies, like you're eating something and suddenly happening after eating something, that is because of the bind is high and it's creating heat and inflammation, right?
Okay.
Yeah, you are eating the wheat.
Our first step
and
will
there is
be
an inflammation in the
SI
colon, right?
Sir, then our first step will be SI rent heat.
In which?
Because this protocol, what you are saying, then heat को rent करना है, so then our protocol will start from SI rent heat.
Yeah. So now I will show. So the step number one, we are choosing the left arm. Means heat. So let's choose the SI meridian. The step number two, left elbow to wrist area. Again heat. So in this meridian, we are renting the heat point. Where the heat? So the heat we will put the perpendicular needle. The perpendicular needle we are putting here, or we can put the seeds, star magnet or methi seed. Now heat meridian open. We are still in the heat meridian only. The SI meridian will open. Now we'll do the treatment. For the treatment, there is an allergic races. Sedate bind and sedate heat. The prime target is sedate bind. As per the 5 element cycle, if we know, bind, heat,
Hotness.
Hotness, humidity, dryness, and coldness, right? So let's talk about the grandmother rule. Grandmother, grandson rule. The grandmother controlling the grandson. If wind is high, then we will go to the dryness. Dryness is the grandmother who will control the wind. So sedate wind and tone dryness. Very good treatment. We are sedating the wind because wind is high and we are tonifying the dryness. Right? So this is called grandmother grandson rule. Okay. Again, I told you sedate the heat also. So we can also sedate the heat here because it's creating the red races. So we are sedating the wind and we are sedating the heat. And we are tonifying the dryness. Dryness is opposite of whether we talk about the wind or we talk about the heat. Dryness is opposite of both. So dryness in the opposite party, we can tonify. And wind and heat in the opposite party, we can sedate both. But our main action is wind. Remember, our main action is wind. So wind sedation, dryness tonification, heat sedation. So now we are doing treatment as per the grandmother rules. So now what we are doing, we have started our journey. First, we are choosing the SI meridian. We are putting the perpendicular needle on the heat point. The SI meridian will open. So now, what we'll do? We'll sedate the wind. So we'll sedate wind. This is the wind. We'll tonify the dryness. We'll tonify the dryness. And we'll sedate the heat. We'll sedate the heat. Wind is main action, which we'll do in the controller and the super controller. This is the controller and this is the super controller. Is it clear to now? We can also
Sir,
do
can we use the bar magnet here?
bar magnet. We can't use here. Bar magnet is doing the bar magnet is bigger.
No, for this sedation and tonification point only.
You are asking bar magnet? Bar
magnet, yeah.
In this
Small
method, we can't use bar magnet. Right now, we can't use bar. Bar magnet will do bigger tonification, bigger sedation. Because see, you can see the just we are sedating the humidity. We are sedating the
Wind.
Wind
and
we are sedating the heat. Bar magnet, we can't put two bar magnet very near. They
one target. One bar
they will
magnet.
do cross interaction and they will do something wrong. Because bar magnet are very effective and so we have some gaps in between.
All right.
And bar magnet bigger. We can't, the point is very short, small. And bar magnet is very long. In this, we can't put. If you want to sedate entire meridian, suppose someone is having very high fever, you want to sedate entire SI meridian, put the bar magnet on SI meridian. Right now, we are not using bar magnet.
So GB meridian also you sedated with na? In GB meridian, what you did? Just show yellow or green
I didn't
color.
do anything in the GB meridian.
No, super controller.
Gallbladder.
GB, super
Achha,
controller.
cover nahi kiya, sir. Yeah, same wind sedation.
You did green color, I think.
No.
No? Okay. You need to put yellow
The
color.
green color is the color of wind.
Mm-hmm.
It's given previously.
Okay.
but I am doing sedation with the yellow.
Okay.
In the sixth energy concept, because points are very, very small and short, so bar magnet we can't use it. We have to use a small seed or needle or magnets, right? Is it clear or not?
Yes.
So now my question is from you. Now this is a homework for you. Let's see here. Now homework for you. Because now you already know the two different classification. So what is the homework? Homework, write down question number one. One person is suffering with the pain shoulder to elbow in the right arm. One person is suffering with the pain shoulder to elbow in the right arm. Pain is a dull pain. Dull pain. The question number one. I told the right arm, remember. Right arm. Not the left. Dull pain in the right shoulder to elbow. Question number two. One person is having numbness in the left palm and finger. Numbness in the left palm and finger. What is numbness? The meaning of numbness?
Hotness.
Decrease hotness.
So what?
The meaning of numbness means the hotness is less. That is called numbness.
So you can say coldness.
What is numbness?
Hotness
Numbness means deficient hotness.
No circulation. So coldness more.
Yeah. You can think in that, but we are not telling that coldness more. We are telling deficient hotness. So we have to increase the hotness. Opposite we can study it, whatever. Numbness means decrease hotness. Okay. Question number next. One person is having.
Sir, please
repeat. I am telling the person is suffering with the numbness in the left. I will write. Question. Number left wrist to finger. This was second question. Question one. Right shoulder to arm, shoulder to elbow, dull pain. Question number three. Psoriasis in right elbow to wrist area. Got it? Psoriasis. Question number four.
So psoriasis is green plus plus we have to take.
Psoriasis is dryness.
Dryness.
The question number four. Numbness written? Okay.
Yes.
The question number four, one person is having heart attack and pain is referring to left arm. Heart attack and pain is referring to left arm. This is the blood stasis condition. Remember one thing, in the blood stresses, we do sedate. We always sedate the point. Because in the heart attack, we never tonify. We either do jingle bleeding or we sedate. Remember one thing. So person is suffering with the heart attack pain is referring in the left arm, shoulder to elbow.
So it should be taken severe pain. What pain should
Shoulder
be
to elbow, right? What are you asking?
blood status conditions, heart attack, what the kind of pain should we take?
You have to think about that. What do you think? You are asking
Generally
what,
severe,
right?
Severe pain, sir.
Severe pain we have to
Unbearable
take,
pain.
right?
The person is having sudden pain which is coming from the heart, referring in the left arm till the elbow, heart to elbow, right? So what is your question?
The severe pain.
So sedate the coldness that way.
Okay, so
Blood
asking what to do, right? Remember one thing, during the heart attack, we will never tonify anything during any acute emergencies. Please don't tonify anything. We have to sedate everything. We know during the heart attack we are doing jingle bleeding, but we never tonify anything. Got it? So what will we thinking about the blood stresses? What is the blood stresses? What to do that? What to do that? You think. Now please try to open your six senses. All of you are super intelligent guys, right? Doing the mistake is a good idea, because if you do the mistake, then when we will learn the correct answer, you will, oh, why I am not thinking in this way, right? So look at it once again here. This is the question number 4. Four questions are enough.
Yes.
Now prepare this.
Last one is interesting.
So the treatment will go in Meridian?
You do all the treatment in Young Meridian. That's okay.
Okay.
Clear?
And then what type of pain will be treating? Just tell the pain type.
We can treat anything. Pain, blockage, varicosity.
So the question she's asking is, in heart attack, what type of pain? It will be dull pain or the severe pain? What type of pain in the heart attack?
Severe pain.
The heart attack and pain is referring. So what type of pain will
So
you
heart
treat?
attack person is suffering with a heart attack, you're telling, oh, I am having dull pain.
Severe
Maybe
pain.
I am going to get the heart attack very soon. Okay, please take me
should we
to the
that severe
hospital.
pain we are
Unbearable.
Acute pain. Acute pain. Acute pain.
Unbearable.
Sudden is
acute pain.
heart attack pain is like stabbing pain. Stabbing pain means someone is pricking the knife.
Yeah.
Pricking with the knife. That is heart attack. Okay.
And blood status then what? On what
Blood
condition?
stresses means the meaning of blood stresses itself is a pain like a someone pricking with a knife.
Okay.
Right? You are very clever. Now you have asked indirectly.
Time up.
But remember one thing, we don't tonify anything. During the acute emergency like brain stroke, heart attack, or please don't tonify. That's why I've taken this example, because in the 6 key you're learning this concept, sedate something, then tonify something. Please don't follow this concept always. Sometimes we just have to tonify everything. Just we have to sedate everything. Right? We will discuss that thing tomorrow. But first you try to do that in your way, right? So let's close now and see you tomorrow.
Thank you, sir.
Thank you.
Tomorrow, if anyone want, can join morning 6:30 class on the anatomy. Because now we are free, our Jinsen Jutsu class is over. So now we are starting anatomy class in the morning. And we don't have any other time other than the morning. Otherwise, we could start in the evening. So
only anatomy you will do? No related protocols? Like
any anatomy.
Okay.
Anatomy. Like how many muscles we have, ligament, tendons, bones. What is the meaning of tilt and when person is becoming like this, forward, backward, what is the meaning of that? That's it all. We'll discuss. Okay. Fine. See you tomorrow.
Thanks.
Thank you so much. Good night.
Thank you, sir. Thank you.
Thank you, sir. Good night.
Thank you, sir.
Thank you, sir.